It's time. Let's call the meeting to order. Thank you for coming punctually. We need only 3 people to get the meeting started. So can we first invite the administration team to join us, please? Welcome the government representatives from the Social Welfare Department. We have Deputy Director Mr. Lam Kartai, Assistant Director Mr. Tan Yi, and Mr. Kok Chi Lang, and from the Department of Health, the Center for Health Protection, Dr. Ma. So we have one item today, and within this meeting, we would like to look at the long-term care services being affected under the COVID-19 epidemic, and that includes daytime, home-based, and residential care services. The government has submitted a paper under the epidemic in the past 3 months. A lot of the services have been suspended or reduced. So the care homes and their community services have been affected. And those affected need long-term care. Frail elderly, the people with disabilities, chronically ill patients, and so on. So they suffer a lot. The residential care services have stopped visiting by family members. And for those who would like to provide services within the care homes like OT, PT, and SD services, they are also affected alike. And for day care services, basically they have been suspended. Of course, if there are special needs for services, the service recipients can liaise with the service units to discuss how to make special arrangements. But to my understanding, most of the daycare services have been suspended. For those who are still manning the daycare centers, including elderly daycare centers, the day activity centers for the PWDs, sheltered workshops, well, basically, their services have been suspended. And for home-based services, apart from 4 services, designated services by the SWT, which should go on, the others have been suspended or only limited services provided, including bathing service at home, providing treatment, cleaning service at the home setting. All these have been affected. The chronically ill are facing dire difficulties. Their training needs, their treatment needs, their daily needs have not been taken care of. So, for example, bathing service. And some people need shopping service, shopping for, say, daily necessities and medical consumables, and also, say, diapers and so on. And they need, say, tubes for sputum suction and so on. All these have been suspended. And also occupational services, including sputum taking, have also been suspended. For those who are hemodialysis, their consumables have not been purchased because these services have been suspended. The SWT is asking for these services to be resumed gradually, and we are happy to see that the epidemic has stabilized a bit. But in the past 3 months or so, when services have been suspended and reduced, we see that people suffer a lot. A lot of the elderly and PWDs, the chronically ill, are having a tough time. my office has conducted some survey, and some community bodies have done some surveys, and the results have been tabled today. And the information has also been provided to you prior to the meeting. So in a minute, I hope that the government can explain to us the relevant arrangements and the arrangement to resume the services. And we can also discuss going forward if we face similar situations in the future, what we're going to do. The epidemic may sort of fluctuate. And so is the arrangement appropriate so far? And the impact is so substantial. And as a result, the service recipients are really having their physical conditions deteriorating. For those who have dementia, their abilities have worsened. So what are we going to do? So in the next 2 hours, I hope that we can discuss these issues and so that we can provide services that would make up for the deficiencies in the services in the past. So can we now ask the administration to take us through the paper? Please be succinct because we have all read the paper. The government's paper explains the arrangements or the operation of the long-term care services during the COVID-19 epidemic and other related anti-epidemic measures. Mentioned by the chairman, since 27th of January, the SWD has issued a number of press releases to announce the special arrangements for subsidized welfare services. Like what the chairman said, in the initial stage of the epidemic, the services at the centers were suspended because we would like to avoid social gatherings and avoid or prevent cross-infection. Despite this, the daycare centers for the elderly and also childcare centers, and even the daycare centers for the PWDs, to my understanding, some service users are still using such services because they do need to receive the services during daytime because their family members are not at home to take care of them. So they have approached our centers, which have opened for their use. The number is not too big. Say, for example, the daycare centers for the elderly, to my understanding, 15% of the service users are still using the service for various reasons. On home-based services, whether it's for elderly persons and PWDs, apart from the 4 essential services which have to be provided by the organizations, including delivery of meals, nursing, and administration of medicine. In early April, we've written to the organizations providing home-based services to ask them to provide personal care service as well, including bathing service, and also helping the service users to purchase daily necessities. The frequencies has increased step by step. It's not that they resume all the service at one go after we've written to them. As for the resumption of service, let me explain a bit. On the 9th of May, we have issued a press release saying that we would progressively and orderly resume subsidized welfare services. There are a few dates that need to be noted. On the 15th of May, last Friday, all the home-based services, including the integrated home care services and enhanced home and community care services, and also home care service for persons with severe disabilities, and integrated support service for persons with severe physical disabilities. On the 15th of May, all the services have been resumed. The service frequencies have been enhanced, and the service volume has also been increased. So we hope to fully resume the service as soon as possible. That happened last Friday. And next Wednesday, 27th of May, for some of the centers, the service users can make an appointment to participate in small groups and programs of the centers. So we will go by the appointment approach. So we don't suggest that the centers provide drop-in service, because you will not be able to envisage the number of users in drop-in services. So that's how we will go about it for now. And then for the integrated family service centers, similarly, whether it's the games corner, those were not opened, but starting the mid-May, then users can use these services, but by appointment. Now, for residential care services during the epidemic, they have continued their normal operation. We do have some outreach teams. We have the multidisciplinary outreaching support teams for the elderly and professional outreaching teams for private RCHDs. And starting the 27th of May, next Wednesday, these teams will resume service for tenants in these institutions. And under the standardized care needs assessment mechanism, the assessor will resume care needs assessment service at RCHEs on the 27th of May. In our paper, we also mention about the different measures, so I will not go into them. I would like to highlight one point, though. In early May, we have launched a allowance for antivirus coating spray subsidy for all RCHEs and RCHDs. Through such a subsidy, we hope that we can help residential care centers to do a better job in sanitization work. So that's it for my introduction of the paper. We are happy to answer members' questions. So we'll now open the floor to questions by members. We have ample time, so we will allow 5 minutes for each member. Dr. Joseph Lee, followed by Mr. Michael Look. Dr. Joseph Lee, thank you, Chairman. I will look mainly at the impact here. I understand that there are a lot of services which have been suspended, but then the service users do still have the needs for the services. Different people have told me that some of the services have been suspended, like what the chairman has said. My question is, for service users like the elderly singletons, they need meal delivery service, bathing service at home. They don't have a lot of protective gear or equipment. They don't dare go out, so they're in dire straits. So what have you done to help them?
Secondly, you're gradually resuming the services, and of course, everyone is happy to hear that. But do you have an actual timetable on how you are going to catch up on delayed services? Let's say some services for the elderly have been suspended, and your outreach team is now going up to conduct assessment, there may be some medical or social needs that they need. So are you going to enhance the services since many of the services have been suspended earlier? Thirdly, I see that the team from the CHG have also reached out to the residential care services, and you have also issued guidelines for them. But then, how can you help the residential care homes, especially for the staff, to follow your guidelines? Do you have some sort of support or resources deployed to them for them to really comply with CHP guidelines? If you're lucky, of course, then you will not get infected. However, if you do not follow the guidelines, there might be a chance that the staff will get affected. So what can you do about that? Thank you. 3 questions. Deputy Director, please. Thank you. Chairman, I will first address the third question. The CHP has issued many guidelines for residential care homes for the elderly and also for homes for persons with disabilities, and updates have been provided on a frequent basis. In the guidelines, staff must wear face masks whilst they are working to protect themselves and protect the public. Starting from February, the SWD has been distributing masks, and altogether we have distributed 5 million masks to staff in RCHEs and RCHDs. This is actually very strong support for them. Whatever procedure they might be working at, they would still need to be protected, and thus we have provided them with face masks. You asked about how we can provide or catch up with the delayed services. Many people, especially SEN children, some of them may be entering primary 1 in September. But most of the time, they have been away from school and have missed out on many of their services. During summer, they will be provided with makeup classes to support these children. We are also considering to provide extra help for those who are entering primary 1 this year. Other than makeup classes in the summer, we are also going to work with their service providers to discuss whether extra programs would be provided for them to help them with rehabilitatory services. So this is something that we are in discussion. You also asked about protective equipment for users. The government provides face masks for service providers. For NGOs, very often face masks have been donated to the NGOs, and some of them have also been donated to the government. We distribute all these donated face masks to NGOs. 8.5 million of these masks have already been redistributed to NGOs for them to reach out to persons with disabilities and their families. Chairman, if I may follow up on one of my questions. The Deputy Director mentioned makeup classes. I'm not asking about that. I'm asking about the elderly who have had their rehabilitation suspended, and that has affected their recovery. Would you enhance assessment or perhaps provide more sessions for them to help them recover. And I'm not only asking about the distribution of face masks. You also need to look into equipment such as PPE. I'm sorry I'm taking up so much time, Chairman, but I would like these answers answered. That's all right. Dr. Ma can answer your second question, but for the first question on services provided to the elderly, that some services have been suspended during the epidemic, the residential care services and the outreach team will conduct an assessment to see where they need to enhance their services. We are working with the organizations and we understand each other. Therefore, they will catch up with the assessment to ensure that services could be provided in a timely manner. And starting from next Wednesday, the multidisciplinary outreaching support teams would also resume their training services. Dr. Ma, thank you. Thank you, Mr. Lee, for your question. We started issuing guidelines since January, and updates have been made on personal hygiene, environmental hygiene, isolation arrangements, etc. The CHP guidelines have been issued via SWD, and starting in January, another division has also been providing guidelines and also making on-site visits to the residential care homes. They have called all the residential care homes in January and provided reminders on personal hygiene, on how to wash hands. They have also visited all the residential care homes to give them views on how to protect their staff and to see what kind of knowledge they need training in. Thank you. Thank you, Dr. Ma. Mr. Lok Chung-hong. Thank you, Chairman. Chronic patients, of course, will see a higher risk during COVID-19, and the death rate for them is also higher. Therefore, we need to provide them with extra care. I have a few questions I would like answered. Currently, many centers only provide limited services. Starting from May 15th, 30% of the services will be resumed, and by the end of May, 50% of the services will be resumed. I'm talking mainly about daycare centers for the elderly. So when would you resume all service intake? Till about 70% or 80%. Now that they are prohibited from going to the daycare centers, would you enhance home-based services? The daycare centers for the elderly are also very important. Because the elderly can meet their friends and enhance their social skills there. So when can you resume this service? Well, there have never been enough home-based services. It's very difficult to recruit caretakers. And with the pandemic, many people are now unemployed. Is this an opportunity to increase manpower to attract the unemployed to enter this sector. As it can really help enhance services provided to the elderly. Do you have such plans to leverage on this opportunity to recruit more people? Deputy Director, thank you, Chairman. Center services such as daycare centers for the elderly, we did mention them on paper that starting from the 15th of May, the service intake has already resumed to 30%, and by next Wednesday, May 27th, the service volume would reach around 50%. These daycare centers support those elderly who are a bit weak, and therefore we do not want them to have the risk of infection. Therefore, we need to gradually resume service. Mr. Look asked when we can fully resume our services. I must say that we must keep an eye on the epidemic. When we relax our restrictions, when the pandemic is under control, then we will gradually increase our service capacity. I can't really say when or which day exactly we'll be able to resume full service. It's really up to the pandemic. As for home-based services, starting from last Friday, our home care service teams have resumed all their training and other services. The service intensity and frequency are also gradually increasing till full capacity. Our daycare centers for the elderly and day activity centers have been in touch with us all through these months. Many elderly like to go in and relax in those centers, but there will be no drop-ins for the time being. They must first make an appointment so that there could be crowd control to minimize infection risk. We do want to increase manpower, and we have conducted surveys on that. We still see a shortage of caretakers. Under the current economic environment, we still do not see many who are interested in our sector. We have talked to many social welfare organizations, and we are thinking about whether we should extend this to the middle-aged, because we right now do have a plan for young people to try to attract them into the sector. We are also trying to extend this to the middle-aged as well.
Mr. Look, I hope that the hire first, training later program can expand its capacity. Next one, Mr. Leung Yu-chung. Thank you, Chairman. Whether we're talking about daycare centers and social centers for the elderly, the administration said that they should tread prudently and be mindful about the epidemic situation, and these centers will only be opened up gradually, say from 30% to 50% service intake and so on. This is agreeable. for the elderly's safety sake, we should proceed cautiously, especially in view of the relatively weaker health conditions of the elderly. But there is a problem here. We know that in a lot of housing estates, a lot of housing estates are aged housing estates, and usually the elderly people will go to the open space in the estates to spend the pastime with their friends. And they will also go to the day activity centers, elderly district centers, to take part in certain activities to spend their pastime. Unfortunately, during the epidemic, the services have been suspended or reduced. Even in the open space of housing estates, it has been cordoned off. The elderly people can't sit there. They don't have a space to play chess with their friends. They really have no space for recreation. So the elderly will don't know where to go. So they can't stay home all the time. And sometimes they may have a strained relationship with their family members. So sometimes they have to wander around in the streets. So how can we help them? It seems that there is no solution. You say that they might have to put up with this because of the epidemic, but we are talking about a very long period. It's been several months already. And for the open space in the housing department, there is no date for the space to be opened up again. People aren't even allowed to sit there. So do you have any suggestions on how to ease the distress of the elderly? So what can we do, Chairman? There is nowhere for them to go to. Over the years, they usually spend their time in such places. So what can we do, Chairman? Deputy Director, maybe it doesn't fall within your ambit, but this is quite a common phenomenon. As pointed out by Mr. Leung Yiu-chung, a lot of elderly people will spend their time in the parks near the housing estates, open space in the housing estates, and they have been closed off for public use. Has the SWD reflected the situation to the management of these housing estates, say, for example, the LCSD and housing department, and asked them to make open such spaces for the elderly? And also the daycare centers for the elderly have been closed. Neighborhood centers, district centers for the elderly have been closed. So there is indeed nowhere for the elderly people to go to. So how will you deal with this? Deputy Director, like I said, for elderly neighborhood centers and elderly district centers under SWD, starting next Wednesday, 27th of May, they will be opened up again. And elderly can take part in the services and the programs on a by appointment basis. And I hope that by that time we can meet partially the needs of the elderly. Mr. Leung also referred to the emotional distress of the elderly. We appreciate that. I've talked to my colleagues in these centers during the epidemic period. The center staff will regularly call up the members of their centers, the elderly, to understand their situation and try to support them. This is what they've been doing. Even though the centers are not open, the staff are doing their work still. As to venues, leisure venues managed by other government departments, I believe that these departments will proceed bearing in mind the overall picture of the epidemic. Of course, we can convey the members' concern to the departments concerned. Any follow-up, Mr. Leung? It's not that we would not do anything to prevent the epidemic from worsening. But should we be going that far? Should we be doing something to ease the plight of the elderly? Well, maybe you will be able to prevent the epidemic spreading, but then you are creating emotional distress on the part of the elderly. I think you should steer a middle course. And of course, you will resume certain services next week, but it's only partial resumption of the service. Can you do more so that they can have more venues or places to go to? But is this the right approach? I believe that the SWD has heard your view. Next one, Mr. Chiu-hung. Thank you, Chairman. Professor Yuen Kwok-yung said that Hong Kong people have won our first battle against the epidemic, but has the government won the first battle? Is it the government who wins and the Hong Kong people lose? Starting 29th of January, all the services for the elderly and the PWDs have been suspended. In paragraph 5, the administration said that from 8th of April 2020, the service teams have provided personal care services for needy services, including assistance in personal hygiene and procurement of necessities. This is not the reality. A lot of the elderly and PWDs do not enjoy home-based services like bathing services. I'm not blaming the NGOs. I'm just pointing out that the government has made improper arrangements. A parent who's taking care of 2 mentally handicapped children, the parents have to bathe for their daughters. And then there is this family of 2 elderly persons. This old lady hasn't taken a bath once in the 3 months from January to April. So after this incident has been exposed, the NGO concerned has arranged for the bathing service for the old lady immediately afterwards. It's only after the media have exposed such incidents will the SWD follow up. Well, it's only when the media exposed such incidents would the situation be improved. In 2003, the SWD have only 25 home care teams, but you could still provide normal services, including bathing, cleaning, escort services, and so on. And back then, the NGOs have provided face masks and other protective gear to their staff. Now it's been 17 years on. How come that we seem to be retrogressing? The arrangements have been haphazard. In paragraph 5, the Deputy Director pointed out that starting the 27th of May, the services will be resumed again, and with the aim of reaching full resumption gradually. So the service resumption is not immediately. Service users could get certain protection, but for the service providers, for the 5 items that I mentioned, gloves and other protective gown, facial mask, and so on, would the staff be provided with enough such PPE? In 2003, when SARS happened, the home care teams could operate normally, but this time, SWD has it set up a mechanism to ensure that the operation of the services can remain normal. Now the epidemic seems to have stabilized a bit, but if the situation reverses, so can the administration guarantee that the home-based services can still be provided as normal? Can you make that undertaking? That is to say, even if the epidemic worsens, the services will operate as normal. Deputy Director. For home-based services, i.e. actually providing services in the homes of the PWDs and the elderly, there are 3 types of services. One is nursing services. The other is personal care services, services pointed out by Mr. Chiu, bathing service, procurement of necessities. And the third type of service is rehabilitation training service. Like what we said in the paper earlier on, I have attended a meeting of the Welfare Services Panel and heard members' views and suggestions on our services. And immediately afterwards, we have written to the home care teams and asked them to resume the personal care services. But honestly, we cannot provide full services at once. But then starting April the 8th, the services are being provided. There has been a resumption of service gradually. As for rehabilitation training, if certain procedures involve close contacts of people, and if epidemic worsens, for services entailing close contacts of persons, the frequency of such services may be reduced. So I cannot say for sure that when, say, the epidemic worsens, all the home-based services will be provided as normal. I will have to look at the individual services and procedures involving close contacts and a high risk of infection. And in any case, we are very determined that we would try to resume full service as soon as possible. In response to Mr. Hsu's question, I would like to say that we do take concrete action with a view to resuming full service for day service, including home-based services. We hope that these services can be resumed in full as soon as possible. I have just written to the service units, and we will provide to them surgical masks and also shields. The Center for Health Protection has issued guidelines on carers providing home-based services, setting out circumstances under which shields and surgical masks will be required. For those who have to provide bathing service for the elderly, they need shields, protective shields. So we've written to the service units, and this Saturday, the service unit will come to collect the face shields. So 240,000 face shields to be provided, and 800,000 surgical masks will be provided so that they can resume their work. In fact, we've called up the different NGOs, and we know that they have some stocks of PPE, but if we can provide such a PPE to them, that can help them so that they can resume their service faster. Mr. Chiu, my question is, well, what if the epidemic worsens? Is there any mechanism to ensure that services will not again be suspended? Deputy Director, like I said, we will be looking at the individual service types. So if for services which require close contacts of the people involved, then we might have to seek advice from the Department of Health on how to do things, asking whether such activities are of a high-risk nature. We have to protect the service users and our staff alike.
I would like to follow up on Mr. Hsu's questions. As I'm not too clear, for example, on home-based services, you said some of them would continue, some of them would be suspended. Suspended services include bathing services and rehabilitation services. What were the grounds for your decision? As Mr. Chiu said, these services continued during SARS. However, this time these services have been suspended. Whose decision was it? Was it the SWD? Well, this time, for COVID-19, we need social distancing because we're afraid of the high risk of droplets that may lead to infection. But for service providers, when they provide home-based services, they will help clean the house or provide personal services such as helping them bathe, stretch, and work on rehabilitation training. Some of the procedures may be a bit higher risk. You may need to help them with coughing out the sputum, and some need bathing services, and these may be more close contact. But then these are only one-on-one services. Generally, we would not think that these would be in conflict with social distancing rules. That is different from centers because many people might gather together in a day center, and the risk posed much higher. But for home-based services, it's usually one-on-one services. Now, what kind of standards do you adhere to in making these decisions on services being suspended? The epidemic continues, or we might need to face similar situation again in the future. Do you have a set of standards to make such considerations, as that would also help the service users understand why their services have been suspended? Deputy Director. Chairman, we continue to review the situation. You asked whether we have mechanism to resume services. First of all, we must have enough PPE, even if it's only one-on-one. Any close contact would necessitate PPE, and when organizations do not have adequate protective gear, then they should approach us for support. We have all learned much from this pandemic. I did mention earlier that recently the CHP issued guidelines for home-based services providers, and they make it very clear what kind of PPE is required for individual services. We also need to assess the risk to the provider and the user. I agree with you, however, that home-based services are usually one-on-one, and there would not be any crowds, which means it is much easier to handle. Rehabilitation services, medical services. When we do have adequate PPE to protect our service providers, then we will resume our services. as soon as possible. I would like to reiterate that individual care services should continue. It's just that the frequency might be reduced. Well, now that you have a PPE guideline, it's still not adequate. We do need a set of guidelines for the homes and for the centers. The service providers and service users should all be very clear about the guidelines. For the continuation of these services, it must be based on the premise of adequate PPE. However, to define adequacy, we must first set standards. I'm not sure where the responsibility lies, at the SWD or at the CHP. Who would be responsible for setting up a set of guidelines? Otherwise, we don't know how you can make a decision on which service could be continued and which service would be suspended. Chairman, I'll try to answer part of your question and then Dr. Ma can supplement. The CHP has already set out guidelines for residential care services, and recently guidelines have also been set out for home-based services. When the CHP drafts the guidelines, the SWD is also invited to give feedback because we understand better the services provided. For other services, may I defer to Dr. Ma? Thank you, Chairman. Residential care homes for the elderly and residential care homes for persons with disabilities. Guidelines have already been issued. We have been working with the SWD to discuss how we can provide PPE and what kind of PPE is suitable in the continuation of services. Right now, we do not have a designated guideline for centers. We will continue to liaise with the SWD to see whether such guidelines are necessary. Thank you. We hope that you would also set up guidelines which are service center oriented. SWD, I would also like to ask about a certain suspension of services. Would you also conduct an assessment on the impact on users by COVID-19? Should improvements be made to your arrangements? For example, during SARS in 2003, home-based services were continued. However, we are not able to do so this time under COVID-19, and some services have been suspended for over 3 months. What is the impact on the users? What kind of services could be continued, providing that you have the adequate PPE? We are talking about long-term services here. Any suspension might lead to deterioration, and that might be irreversible. Would you consider continuing these services? I have mentioned it a few times. Would you review your arrangements? As this might happen again in the future, would you also work out a better plan or set out a set of standards so that people would understand or know what to do under these situations? Chairman, we would of course work on continued review. When the pandemic dies down, we will work with the service providers and review what has happened in the past few months. We have a plan in our department that in case of future reoccurrences, what should be our emphasis. We really do not know when another wave of epidemic will occur. We have learned much from the 2003 SARS and from the COVID-19 this year, and we would use that as a reference in making future plans. As I heard, you would need to conduct assessments for many users. So there might be changes made under new standards. How do you ensure the organizations and service providers would do the same? Let's say an elderly with dementia, his memory is deteriorating after 3 months. He might not be able to take care of himself, and he hasn't seen his family for 3 months, as many residential care services do not provide video calls for families. How do you ensure that if there is a downturn in their self-care capability, are there any measures you can adopt to help them? It's much like SEN students who need to enroll in primary 1 this year. They have already stopped many of their training, and they need to move into a new learning environment in September. We are happy to hear that you are considering providing makeup training sessions for them in the summer. How about other uses, such as the example I gave you on people with dementia or people with disabilities? They do not have these extra resources. So how can you provide them with extra support?
You refer to the assessment and follow-up, i.e. for the service users. Can I defer to my two other colleagues? responsible for elderly and rehabilitation to talk about the work. Mr. Tan or Mr. Kok? Well, I'll go first, Mr. Tan. Elderly, yes. For the elderly, whether the elderly are going to elderly centers or they receive home-based services, if they receive training and rehabilitation training on dementia, they will receive training only after they have received clinical assessment. And sometimes, for various reasons, they would skip the service, and so it's professionals in the organizations who were treating them, like the speech therapists, occupational therapists, and physiotherapists. They will go by their professional ethics and experience to work out a treatment plan for them. In the past couple of months, services for some elderly have been suspended, but our colleagues don't stop working. They still have the elderly's information, and they would be ready to work and to serve them once there is a timetable to resume the service. I believe that the elderly service units do have the capability and manpower to provide the service. Is there a problem with manpower? We will look at the actual conditions. It's very difficult to say whether we lack manpower or not. But then these professionals will work based on their professional and clinical experience and workflow. Mr. Kok, can I supplement on the guidelines? On the 29th of April, the Center for Health Protection issued a set of guidelines for home-based services. So in Annex 1 of the guideline, there are details set out about the different PPE for the different types of home-based services. For services involving close contacts, details are also set out. And for center-based services, they are unlike home-based services. No very close contacts is involved. But then for rehabilitation services and therapy services, there are also some contacts among people. In other words, the guidelines for home-based services are also relevant for the center-based services. So they can look to the very PPE mentioned there. It's the surgical masks, keeping certain social distance, taking temperatures, observing hand hygiene. All these can also be applicable to center-based services. So generally, the service centers can take reference from the Annex 1 of the guidelines for home-based services, so they know what kind of equipment is required in order to resume the services. For rehabilitation services, we're talking mostly about surgical masks, and if we're talking about speech training, maybe really surgical masks should suffice. So this is my supplement for the guidelines. As for assessment, for the home-based service and district support center for PWDs, we have introduced a case management approach. Under that approach, every year, every service user will be assessed based on the treatment plan. So the NGOs, if we are to resume the service, they will conduct assessment based on the personal treatment plan, and based on the changes observed, the relevant services will be provided. Let me cite an example. For support centers for PWDs, apart from increasing the number of centers, manpower has also been enhanced. Say, for example, for district support centers for PWDs, the manpower ratio has been raised to having one center in charge taking care. And then we have also added in more speech therapists and other therapists. So in the past few years, we have increased manpower based on the changing service needs. So the personal assessment for each user will be conducted. And we have also added in manpower. Therapist 2 has been promoted to therapist 1. So all these changes in manpower will allow us to cope with the changing needs and help us resume our services. Thank you. I think this is important, and I thank Mr. Koch for his additional remarks. For center-based services under the epidemic, it seems that different centers vary in their approaches. Mr. Koch talked about district support center. Therapists are stationed there. And also for the day activity centers, there are also teachers and therapists working there. Under the epidemic, will each individual center provide services? As far as I understand, treatment is basically suspended. But can the centers turn the center-based services to home-based services during this period? Maybe you can resort to video conferencing type of services, and also personal calls, as mentioned by the Deputy Director, are also important. But the frequency varies substantially among the different centers. For daycare centers for the elderly, like what the Deputy Director said, some elderly still visit these centers. But for other centers, the staff don't even call the elderly ones. And for some PWDs, they may go to the day activity centers. During this epidemic period, they receive few calls from the center. They don't have video calls. But for some other centers, they call more frequently. For my daughter, she goes to the day activity center. Every week, there will be a video call lasting 20 minutes. There will not be any training service, but at least they are keeping close contact with my daughter. But then, for some treatment and counseling services, they can really be provided through a video means. Or maybe you can even visit the service users at home. Maybe you can also concentrate your resources on certain individuals in need. This is important. The day service is gone. The service users are kept at home. They can't go out, and their functions may possibly deteriorate. So how can we use such services to help them? This is important, but I don't see any clear guidelines from you on that. So the different centers vary very much in their approach. So would you consider formulating such guidelines to incorporate my suggestions made just then? Well, at least you can help as many as you can. We can leverage on the experience this time, and we can write down our experience, and this is good experience. Different organizations have used innovative ways to go about providing their services. Maybe we can collect all these experiences and write them down after the epidemic has stabilized. That can serve as a reference for the NGOs in the future. Deputy Director, I'm not just referring to experience here. You should issue guidelines on these services. We do have the technologies here, video conferencing, video calls are so very common. But then how come that different centers vary so much in how they use such technologies? We talk about the one-to-one, one-on-one treatment service in the home-based setting. The risk is relatively lower there. Why can't you keep these services? And if they go to day centers, which have been closed down, if the service users have great needs for services, can center-based services be turned to home-based services? Because the therapists are still working, they are still paid. I'm not saying that they don't work at all, but their work must be effective, be able to help people. So doesn't the SWT have the responsibility to draw up guidelines, or at least you should give some policy directions to the service units so that they can work according to certain prescribed standards? Yes, we can go along that direction, but then if we do so, we have to be cautious, because if it is a center-based service, we have to be mindful about our requirement for the NGO to operate a center. And, well, even if you can't open your center during the epidemic, you should really call up the service users. You should use some video conferencing techniques to help the service users. That can be done. But if the center-based services have to be turned into home-based services, and we have to be mindful about the contractual terms. And I think some of the suggestions that you made can be implemented. Of course, we take the perspective from the needs of the service users. We appreciate that the day care centers provide center-based services. But then if no center-based services provided, then it's problematic. We understand that. I don't know whether it has to do with the responsibility, the contract, or the insurance, or what. But anyway, I think you should allow some flexibility here. So should there be a need, make sure that your services can effectively help the users. So you should not, because of some administrative and technical difficulties, fail to provide the service users with the relevant services. And today, we've got a letter from the Public Doctors Association tabled in front of you. They think that the ITB's distribution, the CEU surgical masks to the RCHs, and who then pass on the masks to the tenants, they have some concern. But the first thing is that might be the tenants don't know how to use them. And the tenants of the RCH may not know how to clean the masks. If they don't clean the mask properly, then there will be an even higher hygienic risk. And then for RCHEs, the elderly usually go in and out of the hospitals. So if they use the CEU masks, well, the ITB and the FHB said that the CEU masks cannot filter out virus. And if the elderly people wear this mask and think they are well protected, then they will think that they are already protected, but in fact they are not.
The elderly are a high-risk group as they may need to go in and out of the hospital all the time. Although these masks are not distributed by the SWD, it's the ITB that distributes these masks. As the overseer of these RCHEs, would you also consider the use of these masks? Some doctor associations suggest not to distribute these masks to the elderly, as they are not much of a protection and it might pose a higher health risk to them. You need to think from the perspective of the elderly and from the people with disabilities. The Q masks are actually free masks distributed to each and every resident of Hong Kong. When the ITB contacted us, the ITB wanted to cater to the needs of these vulnerable people, and thus they arranged for 400,000 masks to RCHEs and the needy. Therefore, our role is only to redistribute the masks to these people. We provided the addresses of the centers and the residential care homes for delivery of the Q masks. We heard different views coming out from this arrangement. We see tabled here views from doctor associations and also concerns from members such as you. We have already referred all these comments to the ITB. My understanding is that very soon the ITB will send out a letter to RCHEs and daycare centers with a guideline on how to wash the masks. We understand that some of the RCHEs do not have adequate manpower to wash each mask individually. We understand the lack of manpower. The government hopes to provide those in need another option in providing the Q masks. Residential care home users and their families can decide themselves when and whether they want to use these masks. These masks are only for the protection of going out into the community. An elderly person who is sick or who needs to take care of patients or who needs to go in and out of hospitals should not use these masks. The ITB will issue clear guidelines on the use of the mask. We have already relayed all the comments we received in a hasty manner to the ITB. And the masks have already been distributed. now you send out a letter or a guideline, I really don't know whether they would reach the elderly persons or the residential care homes. Well, you understand very clearly that these masks would not be washed individually in RCHGs, and it poses an even higher risk if they wash these masks together. And it's not suitable to wash the mask in washing machines. Therefore, I really don't think these masks are suitable for use for RCHE users. You tell them that these are free masks and they are free to use them as needed. I don't think this point will reach the elderly. The ITB might think that these masks are suitable for general need in the community, and they are very generous in providing them free of charge to the elderly. But many of the elderly do not know how to use the mask or wash the mask properly, and the frontline staff may not know either. And they might really wear these masks to hospitals, which is not suitable at all. So that is the reason why I think that these masks are not suitable for use in RCHEs, and you really must pass this message to the operators and the frontline staff of RCHEs. Otherwise, it would pose an even higher risk. We have neglected patients' mental wellness. Some people are mentally disturbed. The ICCMW also needed to suspend its services. There is not much information on the needs of these people. We only know that it has affected the mental wellness of every single person, and those who are already disturbed find it even more difficult to cope. You play an active role in many of these services. Do you know how serious the problem is? And when you gradually resume services for these people, I hope that you would pay more attention to them. We have also conducted a survey that caretakers also find it very difficult. It's been 3 months, and daycare centers and home-based services have been affected, many of them suspended. Some caretakers need to give up their work to take care of their families, and those who are already caretakers find it more difficult. They have no time to relax. How can you give the caretakers a much needed rest? The responsibility actually lies with the Labor and Welfare Bureau. I don't know why they didn't send any representative here today. You have provided services for the elderly and for persons with disabilities, but you also need to pay attention to caretakers. We're talking about thousands of caretakers because there are over millions or hundreds of thousands of the elderly and persons with disabilities. We receive many concerns by caretakers who cannot control their feelings. They feel very lonely. They cannot vent their fatigue. They are overtired and they are emotionally suffering. Many of them are actually women. They are barely hanging in there under the pandemic. I hope you would also pay them some attention to give them a breather, to support them. That has huge impact on the society, as it would affect the harmony of the society. We hope you would consider helping them or by giving them a breather, one of which is to allow caretakers to hire someone they're familiar with, such as neighbors or friends, to take care of their family members at a fixed time. And the government will subsidize the expenses. Of course, each family has different needs, and the assessor can decide. And that would provide a breather for the caretaker, who can then go out to enjoy a dinner or to meet up with friends. I hope that you would also take note of these views. Chairman, when the epidemic started, our clinical psychologists worked together on tips for the public on how to handle your emotions. And these actually target the general public, those who need to go into quarantine, those who come back from overseas, caretakers, and also for parents who have to stay home to take care of their children who do not need to attend school. Our clinical psychology team did a video on that, and we put it up on our website. We hope that the general public can also take a look at that and learn from it. And every week on a radio channel, we also talk about different topic sharing, such as how to control your emotions, etc. So there's a radio show that we work on also each week to help the general public, because we understand that people all feel ups and downs during this pandemic.
As for the carers, and I know that in the district support center for PWDs, although they are not open for public use, and if really the carers feel so tired and they need some respite, then they can actually take their family members who are PWDs to such centers for some temporary residential respite service. That can be done. So I acknowledge that we should work harder, and in the future, if we encounter similar situations, we will pay particular attention to the pressure of the carers and give them due support. Please continue to watch out in this regard. And then for children and for special childcare centers, and for children who are about to go to primary 1, how is the progress of their work? Because some parents are worried that if assessment is done during this period, is this the appropriate time to do the assessment? Because before they go into primary 1, another round of assessment will be done by the EDB to see what kind of school they are suited to go to. So how should you conduct this assessment now? And in terms of timing, how is the arrangement like? Usual is around April when an assessment will be conducted. And then if they are to go to the special school, then they will go to a special school in the vicinity. And then if they're going to go to a mainstream school, then they will have to choose their own school. So can I ask the AD to answer? Mr. Kwok. We talked to the DH and they said that in the past couple of months, assessment was still going on. Of course, some parents choose not to go to have the assessment, but that's in the minority. But assessment has been going on all the time. They understand that an assessment has to be conducted to see whether the child is suited for a special school or a mainstream school. So the assessment is going on. Second, last year we started a new mechanism whereby a progress report will be submitted to the school on an annual basis, setting out the progress of the child overall. And this year is a bit special because classes have been suspended for a period. But starting March, some parents, we have made appointments with some parents for their children to go to receive training. As for video course, we conduct preschool rehabilitation services through video means. Colleagues have told us that it's been effective. But some children used to be, or parents used to be passive, but then through video calls, parents get to be more active and get involved in the training process. To our understanding, the EDB knows that this is a special year. They will be watching closely how they will provide more support to SEN students. We've been keeping close communication with them. The Deputy Director also mentioned about support during the summer vacation and after the summer vacation. We hope that the special arrangement this year can help children adjust to and adapt to their primary school life. The assessment will help us in considering whether to strengthen training during this children's primary school life. And we have never stopped small group training. And after the P3 students resume classes on the 15th of June, more classes and more training will be provided so that when these children get to primary schools, they can learn better. So that's what we're doing now. Thank you, Mr. Koch. Parents are very concerned about this because the primary school is altogether a different system. A one-off SEN student grant will be given to the schools. As to how schools will expand that amount, whether the services actually will reach directly the students, that's not certain. Whether it's the preschool on-site rehabilitation services or special childcare centers, early training centers, and so on. Individual training and rehabilitation services are provided, but once the children get to primary schools, these services will stop. And in terms of schools procuring services from outside, we understand that the service providers have faced difficulties during the past few months. They can't go to the school to provide services. And as a result, there has been an impact on the contracts. So in September, will the procurement of these services continue? That's a big question mark. And it will have a major impact on this group of students. If children move from EETCs and SCCCs to primary school, they will face a different learning mode. And also, the services offered to them will be reduced drastically, and that will have a great impact on them. So I hope that during this period you can discuss in detail with the EDB the transitional arrangements. For many years, we've concerned about the fact that there will be cessation of service in the primary school. Now, after the OPRs has been introduced some years ago, and this year, this is a particular problem. So I hope that you can extend the service to primary school so that students will not get no service in their primary school. And then I would also like to follow up on the video means for training. We know that it can be very effective because the parents and the carers can also get involved. And the carers then learn how to provide training to the child. But can a more consistent approach be adopted if the epidemic worsens? We might still have to resort to video means. So should some sort of standards be drawn up for such services? And also on elderly services, for visits to RCHEs, different RCHEs have different approaches to whether they allow video calls. So there has not been a consistent approach among the RCHEs. Some are allowed more frequent video calls, others visits through video calls, others not. I understand that manpower and the facilities are factors to be considered, but should you be issuing guidelines on visits through video means so the family members can really visit their elderly relatives in the RCHE through video means? The CHB has issued a set of guidelines for RCHEs and RCHDs for the prevention of COVID-19, and they particularly mentioned that they encourage RCHs to use such video means for families to visit their family members staying in the RCH, so that contact can still be maintained among the family members. They may miss each other and they need to see each other. Well, the SWD provided our input to the DH in drawing up the guidelines. Through the experience in this epidemic, later, if NGOs need to install video facilities so that they can come up with a more systematic approach in providing the service, then we are willing to help them install such facilities, because we do have a fund for that kind of purpose. So if the NGOs would like to do such things, then they can ask us for help in installing such facilities. They can apply for resources from us through this elderly technology fund. Well, this fund was established some 2 to 3 years ago. That was set up in December in the year before the last. $1 billion has been injected into the fund. What matters most is that the organizations are willing to make an application. They have the space for installing the facilities and the technology, and they're willing to use it. Well, if they've got an extra piece of equipment, that means more work for them. They're already short-handed. The secretary said that the manpower shortage in the RHEs is still 17 to 18%. And while they are short-handed and you're asking them to install more facilities, meaning more work for them, they might not be willing to do so. So I think the SWD should be more proactive. I suggest that you draw up a guideline so that the NGOs can install video means to help family members visit their elderly staying at the RCHEs. It's important that the elderly can communicate all the time with those they're familiar with. This is especially important for the elderly who are emotionally distressed, and they need family members to communicate with them on a continuous basis, and that's good to their mental and physical health. I wonder whether the CHB will expand your guidelines a bit, and that the SWD can use your guidelines to help more people. Dr. Mer, do you have anything to add? Within the guidelines for the CHEs and RCHDs, we mentioned about the arrangements for visits. On last Friday, 15th of May, we have updated the visit arrangements in view of the stabilization of the epidemic. So adjustments have been made accordingly to the visit arrangements. We also appreciate that the family would like to visit their family member in the RCHE. And we said that high-risk people should not visit, or otherwise limited visits should be allowed.
Family members can also call or contact the RCHEs and then to help the family members video call their family members. Well, it's fortunate that there is no outbreak in RCHEs. We see many developed countries seeing such serious outbreaks. We see that actually many of the elderly live close together in RCHEs, and we hope that we do not see any outbreak. Otherwise, that would lead to huge concerns. I assume that the SWD has done something right to stop outbreaks from occurring. But it doesn't mean that we can rest on our laurels. The environment in residential care homes are not ideal. They're actually much poor conditions than those in other countries. We need to look into improvements in the RCHEs in the future. Mr. Chiu-hung. Thank you, Chairman. We hope under the epidemic we would see more caring within the society. The more the social distancing, the more we need human touch and caring. Video calling is one option. From February till today, video call is only allowed in subsidized residential care homes, which really is not ideal. The chairman, Charles Mock, Ip Kin-yoon, and I came up with a plan to encourage secondary school students to video call those staying in residential care homes. We worked under limited resources, but did the best we could. I hope the SWD can also encourage other CHEs to work with us. And I think that old age technology is also very important. We need social distancing, yet if we are able to adopt technology, then it's a very good arrangement. I hope the director can encourage organizations to equip themselves with more advanced technology. I emphasize more on video calling, as that is a very strong human touch. And it is a perfect time to introduce technology to the elderly. I noticed Dr. Ho Pak Ho saying that there are 4 types of people who should not use the Q mask. One being those who need to visit hospitals on a frequent basis. You are saying you will relax visiting arrangements for hospitals. So would you also concur with Dr. Ho Pak Leung that you should not use these masks to hospitals, instead use surgical masks? Dr. Ma? The guidelines we distribute to the RCHGs suggests that staff members wear surgical masks because they're usually 3-ply masks that could block out droplets, bacteria, So this is the general structure of 3-ply masks. If you wear a surgical mask properly, it could efficiently block out bacteria and virus such as COVID-19. Therefore, we suggest those working in residential care homes, the elderly also wear surgical masks. Well, I thank you for speaking this in technical terms, that when you visit residential care homes, then it's better to wear surgical masks than the mask distributed by the government, as that is the most efficient in blocking out bacteria. Thank you. Deputy Director, what do you think? Well, you mentioned the funding for technology for elderly use. We set up this fund in December of last year, so that is already 1.5 years, and we have already earmarked 140 million for many organizations to help them purchase or rent technological equipment. Well, we hope that these new technology procured under the fund can really help our CHGs. Well, we've seen many advertisements on robotics and AI usage. We have visited many RCHGs in past years, both for the elderly and for persons with disabilities. Yet I've never seen these robots. Well, maybe there are only single-digit number of residential care homes using such robots. However, there are thousands of residential care homes out there, and we really hope that the introduction of technology can help these residential care homes. For some homes, they're badly partitioned, and wheelchair users already find it difficult to go through the hallways. Maybe robots are not suitable as well. I'd like Mr. Kok to say more about technology. the organizations were very proactive in the past 2 quarters in their applications. We see that technology can really help with the direct caring of the patients, and it can really help alleviate the fatigue brought to staff members. These organizations also visit many exhibitions to explore new technology. I understand that some technology may not be suitable for use in Hong Kong, with Hong Kong residential care homes being so small. Therefore, we also allow the rental of equipment, and this is allowed under the fund. They can also try out new technology to see whether it could be of assistance. We see that many homes explore the funding, and the objective is the same, to really help the elderly. Yes, we really hope that the Innovation and Tech Fund for application in elderly and rehabilitation care could be put to better use and can really help the frontline staff. We also hope that you'll be able to report soon to the public the development of the tech fund. Time is almost up. We need to return the room to the next panel meeting. We have discussed today anti-epidemic measures for long-term care services during the coronavirus epidemic, and looked at the impact on service providers and users. I hope that after this discussion you would follow up on our views. I really hope you would review your measures. We must learn from our experiences to prep ourselves for the future. The meeting is now adjourned. Thank you.